All right.
Thank you,
Recording has started.
Good afternoon, everyone. I'm Naomi Griffith. I'm a senior policy advisor with the Division of Financial Regulation at Oregon DCBS. And this is our RAC meeting for 2021 Senate Bill 763 relating to the licensure of pharmaceutical sales representatives. Just as a reminder, please try and remember teleconference etiquette, mute yourself when you're not speaking. You are welcome to have yourself up on video if that's your preference, or not if not. For the members of the public who are on the call, we do have some time reserved for public comment towards the end of the meeting. And if you could reserve your thoughts, if you have any until then, we would really appreciate that. Because of the awkwardness of Zoom calls, I am not going to do a formal roll call, but we'll just go over the RAC membership that I've seen. We have representation from industry, Anne Marie from Bristol Myers Squibb, Daria McGrew, excuse me, from Pharma. Do we have Brian on? Did not see Brian actually.
Yeah, I'm on.
Brian's on. Okay, sorry. Ryan Von Hoy from G&M Health representing CLE providers. Chloe Becker from the Oregon Coalition for Affordable Prescriptions representing consumers, and Rick Blackwell from Pacific Source representing insurers, and Mark Bonaro from the Oregon Medical Association representing providers. I already know that we do not have Maribeth Guarino from Mossberg, was unable to make it. So, our consumer interests are represented through OCAP today. So it's been about a month and a half since we last met. I'm going to go through sort of a general overview of the plan for today. I'm hoping we will not use the full hour and a half. The changes to the rules were pretty minor between the last draft and this one. So just general intent is to go over changes to the draft rules quickly. I'll invite the RAC membership who sent in comments to me since the last meeting to share any thoughts that they might have. We'll have time reserved for public comment, and then I'll go over the sort of next steps and the timeline that we're looking at for filing a notice and going through the formal rulemaking procedure after this. So Karen, if you could pull up the draft rule, that would be helpful.
Okay. Red line version?
Not the red line. It's okay. Just the clean copy would be better. So I haven't made major changes to the rule in terms of substantive changes. And I know that there was a lot of interest in discussion around the monetary value provisions. We have not put any changes to that based on, I think, reasoning that I've discussed previously. Is we think that the law requires reporting of monetary value, and I've tried to approximate a definition that gives some guidance on what we're going to mean by that, since, of course, examples are given to healthcare providers at no charge. They're not expected to sell that, and no value after that point, but it does have some monetary value in terms of cost of production, value to the company, we're presuming. And I did also attach a PDF copy, or asked Karen to attach a PDF copy of the exchange between Q Pharma and the FDA in relation to their interpretation of the drug sample reporting program and their sort of general, the initial feedback that was given in terms of whether that is permitted to be assigned a value. Just to summarize, the general gist of that was they think that part of the rationale of the drug reporting program is because there is a value to prescription drug samples, which doesn't necessarily, and that they don't think that the law prohibits assignment of an internal value. It's merely placing restrictions on, of course, providing the requesting payment for healthcare providers or allowing them, not permitting those now samples after the fact as well. So there's
Maybe before
two,
you before you move off of that one, can you clarify if DCBS is relying on that email communication and making its determination?
No, I'm relying on internal guidance and discussions that I've had with DOJ. As I said, we do not have a formal public opinion issued on that, but if the issue is pressed, like we'll come to that in the formal rulemaking.
No, I meant the email that you attached from Q Pharma with the FDA employee who was opining. Are you relying on that at all?
No, I'm not relying on that. I'm relying on our internal interpretation of the law.
Thank you.
No problem. So there are two very, very minor changes that I've made to the current draft that I'd like to highlight. Let's see if we could go to page 3 at the top, Karen. So this is specifically subsection D. This is requirements for an application for licensure renewal. Previously, this read for any renewal application submitted on or before April 1st, 2023. The intent of this was to be on or after April 1st, 2023. What this simply is saying is for renewal applications that are submitted before that time, we're not going to require evidence of having reported the various annual reporting information, since no such reports will have been made. But for applications that are submitted after the first reports are due, that will be required. Is there any questions or discussion about that change?
I mean,
And just as a reminder, I'm directing that to people who are formally RAC members at this point.
hey, Numi, Daria here. Can you hear me?
Yeah.
Right. Yeah.
Go ahead.
I was wondering about, I'm checking from red line to on D there in the second part of that sentence, the applicant for renewal is for any renewal application, the applicant for renewal, was that supposed to be the application for renewal or the applicant has submitted?
The intent there is just to have for as part of a renewal application after the annual reporting requirement has gone into effect, which right now we have set as April 1st of 2023, that there is verification that they have sent in any required reports. I mean, precisely how that's going to be precisely how that's going to work, we'll figure out, but it's just the general intention is that we want to make sure that people who are renewing licenses have actually submitted the required reports. Does that make sense?
Yes. 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 Sorry, I'm stuck on
It's rule language is
grammar.
often.
Yes.
often.
I'm stuck on grammar. But I get the intent, yes.
Okay. So that's the
Yeah,
intent.
Obviously,
Sorry.
the applicant or the applicant's employer, obviously, because we're submitting in the aggregate here. You'll okay.
Yes, applicant or their designee, which would presumably be the employer.
Or that the information has been submitted.
Yes.
Okay.
And we should
Maybe
be
we
able.
could rework that. Maybe we could rework that. So it's pretty clear.
Yes. I do remember the sort of designee discussion was something that came through. Like I think it's adequately implied in the rule itself, but I do recognize that that's a concern. Certainly the intent is for either an employee, a licensee to be able to submit materials directly or submit an application directly, submit reports directly, or to have their employer do so where that's appropriate, and that's the arrangement that's been made.
Okay, thanks.
Any other questions, thoughts on this change? Okay. There's one other item that I wanted to note that could be considered substantive. Find it on my file. Karen, if you could go down to page 5, and I'm going to be looking at 635. So I had some internal edits that were returned to me by the program team suggesting the original drafting of the sort of course materials required for, or the topics of study required for initial licensure were too narrow, and that since we're not offering our own course, that there might not be adequate courses available in order to satisfy that, since we are planning to basically accept pretty much everything that Chicago, not Colorado, everything that Chicago is for the first year, and probably moving forward that will continue.
Hey, Numi,
Yes.
this is Brian, and I apologize for interrupting, but before we go into the continuing education part, you were just discussing of, prior to April 1st, that you've met all your reporting requirements, correct, for the previous year. On that reporting requirements, I'm still a little confused, and I'd like to request a formal response from actually Oregon or your legal counsel, how this does not, how is all these requirements not preempted by the federal reporting, since all this information is already available for Oregon residents, with the exception of the value of the sample. So I don't know, that's something that I'm still really puzzled how the law gets passed and not violate the federal preemption that's already on the books.
I'll have to get back to you on that more specifically. I will go over the issue you raised with, I think it was the Sunshine Act issue. Is that the one that you're referring to?
Yes.
Yeah, I'll go over that with our legal counsel and let you know. I mean, one of the things that we've discussed is the reported information is we're not planning to publish it. We're not planning to release it in any way, mostly for our internal purposes in terms of for the purposes of maintaining the licensing program. So my expectation is that this information is not going to be released absent public records requests and everything that is related to that. So
But I guess I would say that, then you could get that information by logging onto the site and access it, since we're already submitting it to the federal. But yeah, I understand. Seems like it's an administrative burden that's not required.
Yes, I will double check that with our counsel. They're of course, like, I am hoping to have this be the last RAC meeting, but this is not the last opportunity to provide feedback.
Okay.
And
Thank you.
if necessary, we will make changes, particularly if the law requires it.
Thanks, Numi.
And that's been an issue, Numi, that we've been raising from the beginning. You haven't had those conversations with internal yet with regard to the federal preemption?
I think the
This is like
issue,
the fourth time raised.
the issues that were raised initially, I think, were primarily the ACA drug reporting things, which we have.
Right.
I have addressed those with counsel. I have shared
Yeah,
all
it's
the
not-
comments that reference.
Just to clarify, the ACA open
It
payments
is the same.
is spend and samples. There's 2 sections. The spend, all that stuff's already in there. It's more than just drug.
Yes. Well, I did go over.
The preemption is on the states mandating the reporting of it. It doesn't deal with what the state intends to do with the information. So I think it would be really valuable, since we have raised this issue about 4 times now, that we get clarification with regard to the compliance with the federal Sunshine Act preemption, state preemption. We're all trying to build our systems right now, and that's been pretty problematic in the sense that overlap. It doesn't need to be that complicated, and you guys can obtain that information as, was it Brian? Was that Brian speaking? Brian, who said that it's
Yes,
available
sorry.
federally.
Rick, did you have something to add?
Well, I mean, the discussion we're having here is really about, I think, the underlying legislation. And I think what is in front of us here is the, kind of your amplification of the legislative requirements that are in front of you. And so I think it's probably, a good side conversation to have. I wonder if the proponents, the chief sponsors had reached out to LC when the bill was moving, but I mean, we still have to get through the draft is what I'm trying to.
Yeah, I understand that, but I guess what we would want to do is make sure that there is a method, right? If I understand you're executing the law as written, but we need to make sure, first of all, was that done? Was that due diligence done? And if not, if it was, we'd like to see the rationale for it because we're not aware of it. And what process would we have to go through to get that started? I don't know if that's fair.
Yes. Well, so I had shared pretty much all of the statute citations that were provided to me in my discussions with counsel, and I don't think that there was any response that we would be prohibited from doing these things at this point, but I recognize that it's a concern, and I will get back to you on that. So if
Do you want a formal request for an opinion? Do we need to get formal?
Yeah, or from pharma?
Or Brian?
I mean, if I think
I'm just asking what you need. I'm just asking what you need because we've brought it up, like I said, 4 or 5 times now. Still kind of waiting to hear what the exemption is that you're relying on. And each meeting we go through, we talking about it at another meeting. And it would be great to have that clarification as we're trying to build these reporting systems that our folks have to comply with right now, even though we're not 100% convinced we even have the final template yet.
Absolutely. No, I understand the frustration. It's I don't think that there's been anything specific that was flagged to me as prohibiting this from our council, but like I will. I think certainly in advance of issuing final rules, if this is the path that we are sticking with, which is my intent in terms of following the statute as I read it, like we'll do whatever due diligence is necessary in order to issue the rule. And so I don't think a formal request is necessary from an external party, but I will take this back to my leadership and also go through DOJ and see where we stand on that. And I'll get something a little bit more rock solid in terms of issuing the final rule.
That'd be great. And I know that you could refer back to several of the comment letters you've received over the past couple of months with those
Yes.
the specific topic in it, and it would be really great and efficient, I think, to have it addressed. And specifically what I'm asking is what exemption from the preemption are you relying on?
Right. Yes. Yes.
Thank you.
Absolutely. I'll take a look back at that, and I will try and get a response to you as soon as possible. I mean, I'll go over the overall timelines for this rulemaking towards the end of the meeting, but it's tight, to say the least. Let's see, where was I? If we could go back down to 635, I don't think there's anything to be said on it that hasn't already been said at this point. And with regards to the Sunshine Act issue, I will commit to trying to get something back to y'all this week, if at all possible. Oh, and I do apologize for not getting materials to you sooner. I mean, obviously the changes to the draft rule were pretty minor. So the session has been continuing, and my ability to spend a ton of time on this has been limited. So other substantive change that I made to the current draft, we did receive some feedback from our program staff that some of the initial course items identified they thought might be too specific, and that since we're not offering our own course, that it would be too difficult to require coverage of these things. So what I have done is broaden these definitions slightly while still trying to keep them in the same area, and gone back and checked Chicago to try and make sure that there are courses in sort of general areas that would be able to satisfy that for the initial licensure requirement. So previously, A was just clinical effectiveness of pharmaceutical products. I've switched that to add evidence-based medicine and basic pharmacology. There are courses approved in Chicago for all of these things. B was originally comparative cost effectiveness of pharmaceutical products. I've added or pharmacoeconomics, which basically means the first thing, and there are a number of courses approved by Chicago related to pharmacoeconomics. And the last one was just professional ethics originally. I've broadened this slightly. There are several courses approved by Chicago that match this general category. Daria, go ahead.
Sorry, just double unmuting myself. Thank you. I just sort of want to reiterate a little bit of that concern that I know you're trying to address it, but this ABC is still fairly specific and more specific than the underlying statute. And I do have some concerns that 10 hours, it might be hard, it might be overly prescriptive to get to 10 hours. Just raising that as a concern.
Yeah, I appreciate that. Again, there's just sort of general reminder that the last clause must cover at least these topics, the A, B, and C, and may also include any other topic. So, and fill it out with the listed topics that we have in 2A, which are generally the full list of topics that we are having for renewal application education requirements. And we have stuck with the 10 hours versus 5 hours just on the general philosophical approach that initial education, we generally expect to be more extensive than renewal education. So 10 hours versus 5, that's where we've landed. Any other questions, comments, concerns? Chloe?
Numi, thank you for providing this. I want to just say that I think that this makes sense, but do want to just make sure to give it a closer look. I think like you and so many others been kind of engulfed with session things. And so I want to just say thank you and that I think this makes sense, but want to double check it. And if I have any comments or other thoughts on it, we'll share them with everyone. But think that this makes sense. And given the open-ended piece in the second part of coming to those hours.
Absolutely. Thanks, Chloe. Any other thoughts, questions, concerns on the education requirements piece? And I will note that I did provide, again, a red line, which reflects both edits, I think, that were from previously from between December and January, and then also all the edits that have been made to the document since then. I recognize that's a little bit confusing, but it's kind of an artifact of the way that the drafts were passed back and forth internally. So I do apologize that it's somewhat difficult to track. There are a number of minor changes throughout the rest of the draft. Most of that's just for linguistic consistency. There's a couple of spots where I renumbered subsections since there had been numbers removed, just simply to try and make sure that all of our subsections are numbered in a way that makes sense. There was a few sort of scattered professional education or continuing education or continuing professional education references that I've removed and just reduced back to education. As we discussed at the last meeting, there was some concern about triggering other requirements by using those terms, and so that just referring to education requirements throughout the draft. And there's a number of places where because we had taken text from rules for other programs, we had references to the director, as the director shall designate, which just for consistency with the way that I drafted, I just replaced that with department for consistency across the way the rule had been created. So I don't believe that there were any other substantive changes. It's just these few minor things, that the timing of the reporting requirement in relation to renewal applications, and second, these minor changes to the education requirements to try and make sure that there is courses available that people can actually take to satisfy the initial licensure.
I'd be eating lunch or something, and I'd look out the window and I'd see a cat looking in. I thought, oh, maybe he wanted inside, so I'd walk up to the door.
I think somebody is off mute, or who maybe is not intending to be. Okay. All right, so that is basically what I wanted to cover from my end. We did receive comments from Pharma, from Anne with Bristol Myers Squibb, and from Brian at GNM. I have some time set out if you would like to go into any detail or thoughts beyond the written comments you've already provided, or share it with the group and have feedback. Most of that was directed towards the monetary value issue, which our position has been that we're not going to change that, and we don't believe that's precluded by federal law. But if Daria or Anne or Brian would like to share further thoughts on the comments that were submitted, other than things that were already discussed, such as the Sunshine Act issue, I have reserved some time for you to do so. Would any of you like to share anything additional on that?
Just a question for you as far as the template goes.
Mm-hmm.
Are you guys going to post a final template and let us all know that this is it? This is the final one. We've had 3 changes now, and we want to make sure that we are guiding our systems based on what the final template is going to look like.
And you're asking about the reporting form, is that correct?
Sorry, yes, the online columnar, reporting document.
Do we have anybody on from the program team, Christina or Haven?
You can let me know. It doesn't have to be.
I don't know if my microphone is working. Can you hear me?
Yes, we can hear you.
This is Haven. Yeah, we've kept it updated, and we don't believe there's going to be any further changes unless we discover something else. But we, as far as we're concerned, we haven't had any requests for any changes for a couple of weeks now, a couple of months even. So what we have up there is what we are directing people to use.
Okay. One of the changes one of the comments that we added was the fact that there are some HCP types on there that actually are not authorized to prescribe or provide or dispense pharmaceuticals in the state of Oregon. And we were wondering why those were on there. And then in addition, what HCP other is intending. I mean, the folks who can prescribe and dispense or prescribe, dispense, provide, I think the language is in the statute. In Oregon, it's a finite group, and it seems that that drop-down list contains more than what the bill requires. But I'm just wondering what your thinking is in that regard, and whether or not that can be cleaned up.
Well, we placed other because people kept coming up with examples of things that didn't fit in the list, which is why we expanded an or the other as a catch-all. This is the first I've heard of someone saying that the people in the list can't prescribe. We were covering all of our bases to cover all scenarios that we could possibly think of. I would be interested in which ones, and if it's not required by the statute, and just because there's an option for the drop down, not sure why that is problematic.
It also
Because it
comes,
implies required reporting,
right.
that's why.
So then, for
it-
example, calling, I think we talked about calling, you would track the front desk. If they answered the phone, that's time we have to track. And that's an interaction with somebody who's answering the phone. There's no way, we don't track that. There's no tracking of it at all. How do you report it? We won't know who
Well, and I
answered.
was looking at the licensed clinical social worker and the licensed psychologists that are on there, and the others. So I was looking at those specific entities. So, and maybe Haven, maybe, I don't know if you get our comments to review, but I did put that in my comment letter submitted on February 1st.
Yeah, I typically wouldn't review those specifically. My concern about limiting the list is Numi and I can have those discussions. The other will stay in there because I just feel like there is always the chance that it's going to be somebody that we don't have listed, and then people will assume it doesn't need to be reported when it actually does need to be reported. So I'm not going to take off the other, whether or not we take off the other ones. And we can always, yeah, I think I haven't seen those comments, so maybe those can be forwarded to me and then I can discuss it with IT.
Sure, and it was, like I said, it's as simple as, I think it was the licensed clinical social worker and the psychologist, neither of whom are licensed to prescribe, dispense, or provide RX in the state. I think it was just those two.
Okay, well, appreciate that, and I will make sure, Haven, that you see the comments from Pharma on that, just for context.
That was Anne with Bristol, just FYI.
Yes. Oh, sorry, Anne, of course.
That's right. I don't mind being confused with Daria.
The other question
Yes.
that on that same kind of topic through there that I still don't think I have full clear understanding of, and you may think it's simple, but I don't think it is, a good definition of what is a gift, what is not a gift.
Do the representatives of the proponents of the bill have any thoughts on the clarity around gift?
I can check in and see if there's other language you'd want to point to. I'm sure there are plenty of other examples from other rules and things like that that we could share as options.
Okay, I will consider adding a definition of gift to the definition section, but if I get some suggestions.
Because that term can be in the eye of the beholder.
Yes, absolutely. Any RAC member? Rick, did you have something?
Numi, it does look like the word gift in the statute is used together with samples and materials, so maybe that'll help confine any definition you put together.
Yeah, appreciate that.
I think it says samples, materials, or gifts. So
Yes.
it's obviously different from materials or gifts. So gift is not a material or a sample, but what is it?
I mean, I think the sort of classic example would have been a pen, but most companies aren't doing that anymore.
Well, that's prohibited.
Materials are brochures.
Pins and pads and cups and things have been gone for over 10 years, 15 years,
Yeah, well,
Yes.
that's prohibited.
at least 15.
Yes. Well, I have a little bit of flex on my schedule. If any RAC members have any other thoughts that they'd like to share, current draft, and I will get, with the exception of next steps, which I will get into after our public comment.
Okay.
All right, and I forgot to invite members of the public to message Karen if they would like to speak, but if you'd like to speak, I have some time reserved. Do we have any members of the public who would like to comment? All right, well, hearing none, I'll get into next steps. So there is a couple of items of paperwork that I still need to get finished, one of which is the small business impact statement, the other one of which is the new racial equity impact statement. My
Hey,
general
Numi-
thought has
Numi-
been that there will not be a racial equity impact for this, and that's probably going to be the basics on that. With respect to small businesses, we do, for these purposes, I believe, define small business as 50 or fewer employees. And since this is a new licensing program, we don't have full visibility into how the industry and the profession is structured. I was curious if any RAC members have any insight into whether they think any pharmaceutical sales reps would be considered small businesses under the definitions of Oregon, or if we're pretty much only talking about direct employees of pharmaceutical companies. Maybe Brian, do you have any thoughts on that?
I don't, and I don't remember what your number is for small, but I doubt if there are any in Oregon, but that doesn't mean, I mean, I don't know for sure, but I doubt it.
That's kind of my suspicion as well. Is it's 50 or fewer, but so like, I think the sort of an example would be somebody who is working as an independent contractor for, say, multiple pharmaceutical companies as a representative, but I don't.
You could have companies, there are companies that are, biotech companies that may have a product that's about to be approved, and now it doesn't fit, but once they do fit, and they may be small, and they may meet your definition if they're in Oregon, if they're headquartered in Oregon.
Okay. Yeah, I appreciate that. Anybody else have any?
We can forward that
Go
off to Bio too, with Oregon Bio, and just have them connect with you as to what they think, if that would be helpful.
Yeah, I'll check with, I think it's Rocky is still the.
Yep.
Yes. Okay. Yeah,
Exactly.
I'll send a message to Rocky and see if
Okay.
he has any insight on that. Let's see. So paperwork things, I will get drafts of those to the group this week and would appreciate comments back on those. I had hoped to have them ready for today. Taken up most of my time lately, so I do apologize for not having that quite ready yet. The other thing that I'll mention, so long-term timelines, we need to have a rule in effect by mid-June. So sort of target timeline, if for our notice, we're going to have that notice of proposed rulemaking filed no later than April 1st. My hope is to do that sooner, expecting, let me see, one sec here. Pull my notes back up.
What'd you say wasn't ready, Numi? You apologized and said something wasn't ready yet?
Just the paperwork, the small business impact statement and the racial equity impact statement.
Thanks.
So that will be filed the end of April. So that, right. Hang on here. I got too many racks going on right now.
So expectation, notice of rulemaking will be filed this month. We have, I believe, a public hearing penciled in for May 23rd. And so we should have a file date for the final rule of June 15 to go into effect on June 17th. So that's where we're sitting with things going forward. A sort of action items for me is those two statements that I'd like to get feedback on. Once I have them drafted, I will get them to you this week. Would appreciate comments back if there are any comments by the end of next week. And then the remaining other thing is I will circle with DOJ, raise the Sunshine Act issue again, see if they see what our leadership thinks about having a formal opinion with that issue, if we think it's at a level where that is necessary, and we'll have that. If we believe it's necessary, we'll have that ready for the notice. So this month as well. So that's kind of everything that I have looking forward. Of course, after we file the NPRM, there will be opportunity to file, to submit written comments. There will be the opportunity on the hearing on the 23rd of May to come in and give and submit oral comments or submit written comments. And so this is not the last bite at the apple, but I am planning for this to be the last RAC meeting. Much as I would love to see you all again next month, but.
Well, Numi, just to clarify, I'm not requesting a formal opinion. I don't need to see a formal opinion. What I'd like to know is, as I said, which one of the 3 or 4 exemptions the
Right.
state's relying on to
Right.
override the federal preemption.
Yes.
And why?
Yes.
How you think
So
they apply.
that's helpful. I think that was reflected in your last letter.
Yeah.
And so that is what I will take to DOJ.
And mine. The also,
and Brian's. Yes.
and then the other part, let's not forget the gift part. So we're not going to have another RAC before it's finalized. This is it.
That's the intent, is for this to be the last meeting. I mean, absent stripping a lot of text out of the rule, because we do have an opinion from DOJ that that some of this would be precluded. I mean, I don't anticipate any other major changes to the law, and I will pose the specific question of what exemption we would be relying on to DOJ, and get information back to the group. My intention is to do that this month.
And I guess going back with that point of, not knowing the definition of gift or whatever, I think we brought this up before, if that's not been finalized, and here it is March, April, should the reporting not start until that is finalized? Because companies
so
may not have tracked it.
The first reports aren't due until 2023.
Yeah, but
so
beginning January 1st of 2022 or March or April. You see what I'm saying?
Yes, I see what you're saying. So for the sort of timelines that we're tracking, we are requiring first reports from next year in 2023. That would be covering this period of time as well, from January 1st of this year. So
yeah,
I think we can try and nail that down. And if anyone has suggestions for language for a definition of gift, I mean, please send them my way. And if I get feedback on that, I'll circulate it along with the other materials and see if there's any dispute of that. I mean, I would like things to be as clear as possible in terms of what our actual expectations are. So I will keep an eye out for that.
And I think we talked previously too, Numi, about the possibility of some sort of reference in the rule that actually reflected the department's flexibility in the information that was being collected between January 1, 2022 and date X, when the rules are finalized. And we're all doing our best to make sure we've got 7 systems we're trying to unite here in our company, but I think that some reflection in the rule of that flexibility would be greatly appreciated. The flexibility in terms of enforcement, especially because some things are still unclear as far as what your final ultimate requirement might actually be.
Absolutely. I mean, I don't promise that I'll write something into the rule, but like I will make sure that something is put on the record reflecting that expectation.
Thank you.
Any questions, thoughts, concerns from RAC members? Did you have anything else, Anne?
No, you said get comments back to you. Did you give us a deadline?
So what I asked for, so I will send around the sort of additional materials for my goal is to do that this week. My expectation is I will do it this week. And would like comments back on those by the end of next week. Just simply trying to get the notice filed by April 1st, as I mentioned. So timelines are a little bit tight, and just trying to get anything additional in so I can make the changes in time to have them in place, particularly if there is anything that necessitates changes. I don't expect to do another meeting. If there's any other changes that we're making, I'm hoping to be able to address them by email. And so I'll send around the modified text or the additional text to the group and just see if there's any feedback on that. And since I don't know precisely when that's going to happen, I'll send expectations then. But just I would say if you want to guarantee that I will be able to consider something, that it is at least a week before April 1st, if that makes sense. All right. Any other questions, thoughts?
Thank you.
Thanks, Brian. Thanks, everyone. Well, I want to thank you all for this journey that we've been on together and for lively, mostly respectful discussion. I appreciate all the feedback that we've gotten. And recognize it's controversial in some areas. I know not everybody is going to be happy with the final rule that's out, but I certainly hope that I have tried to do as well as I can within the constraints of the laws that are written. So thanks all for your participation. I'll get those additional things to you this week, looking for comments back on those end of next week, and any additional thoughts, comments, written materials, please by at least a week before April 1st so that I have time to look at them before we file the notice. So with that, thanks everybody, and I'll give you back half an hour of your afternoon.
Bye-bye.
Thanks.
Bye.